Hi, welcome to my video presentation on Cefuroxime axetil. My student ID is U3262588. This video shall discuss the pharmacodynamic and pharmacokinetic properties of Cefuroxime axetil. I will also discuss the interdisciplinary team that works with the coordination with patients' prescribed drug as well as some key counseling considerations. Cefuroxime axetil is a second-generation oral cephalosporins antibiotic. It is a moderate-spectrum antibiotic with anti-hemophilus activity. It is used to treat many infections which are caused by bacteria. It is not effective for viral illness such as cold or flu. It is an oral cephalosporin which is rapidly hydrolyzed to an active parent compound, that is cefuroxime, after its absorption. This drug is used to treat various bacterial infections such as bronchitis, acute sinusitis, acute otitis media, surgical prophylaxis, urinary tract infection, gonococcal infections, respiratory tract infections, and skin and soft tissue infections. Let us have a closer look on the pharmacokinetics of cefuroxime axetil. Oral administration of the cefuroxime axetil is absorbed in the gastrointestinal tract. Cefuroxime axetil is converted to the active compound cefuroxime in less than 3 minutes once observed. Due to the rapid conversion, it is not possible to detect cefuroxime axetil in the systematic circulation. Moreover, the administration of food with it sustainably increases its absorption in the body. Bioavailability of this drug on a patient with empty stomach is 30%, but patient with food in the stomach is up to 60%. Cefuroxime axetil, as cefuroxime, is approximately 30% protein bound and has a volume of distribution of about 17.1. Distribution of this antibiotic into body fluids and tissue is variable. However, it does penetrate well up to 35 to 90% into the tonsil tissue, sinus tissue, and bronchial mucosa. It is not metabolized and excreted as it is in the urine. However, axetil is metabolized to acetaldehyde and acetic acid. It is an acetoxyl ethyl ester prodrug of cefuroxime which is effective orally. In patients with normal renal functions, the half-life of 500 mg is 1.2 to 1.9. However, in the patients with impaired renal functions, half-life of 500 mg is 3 to 17. Let's talk the mechanism of the cefuroxime axetil. Cefuroxime axetil is a second-generation cephalosporin that contains the beta-lactam ring structure. It is bactericidal antibiotic because it binds to target proteins known as penicillin-binding proteins. After binding, it inhibits these proteins from the cell wall synthesis, as a result of which bacteria in the body cannot divide and mature further. Thus, it prevents patients from bacterial infections. There are many reasons of the adverse effects of the cefuroxime axetil. It can happen because after taking this drug, quantity of bacteria in the stomach and intestine gets changed, and which leads to gut microbiome. It is also important to know that side effects of this drug are more associated with the patients having impaired renal function. Also, the side effects can get worse with the increase in the dose. So when we look at the humanoid model, there are a lot of side effects such as headache, dizziness, seizures, rash, nausea, vomiting, body pain, burning while urination, and a diarrhea known as Clostridium difficile. Cefuroxime axetil is Schedule 4 prescriptions only medicine. It means you can only get this medicine with a prescription from an approved provider. Also, pharmacists can dispense medication to patients who have valid prescriptions. Let's talk about who can prescribe this medication. Health professionals that can prescribe this medication includes doctors, midwives, general practitioners, and nurse practitioners. When we talk about its administration and counseling, the above mentioned prescribers can work together to counsel patients and help meet the patient's need. While giving and prescribing medication to any patient, there are some important points that needs to be taken care of. The first is it should be given to a patient with light meal because it increases its absorption. Secondly, if you are allergic to anything, tell your doctor or pharmacist before taking this medication. Moreover, it is very important to know about its proper use. You should take your medication as prescribed and not miss any doses. Also, it should be stored in a suitable area. Take few moments to test your knowledge on cefuroxime axetil. I hope you enjoyed my presentation. Thank you so much.